Mr. Speaker, it is fundamental that when a child has a condition that has been identified and there is a treatment for this condition which can make a difference and can last a lifetime, that child be diagnosed and treated promptly.
No kidding.
For example, though a child may be diagnosed early with autism, access to effective treatment with ABA therapy has very long wait times in Manitoba. This is not the right thing to do.
Unacceptable.
What immediate action will the government take to ensure every child diagnosed with autism can begin receiving treatment within 4 months of diagnosis?
Thank you very much, Mr. Speaker. Our government has a strong record of supporting children that are diagnosed with autism spectrum disorder. We provide a continuum of services to the child and to the family. We've even gone so far now with our new strategy to the age of 21. It happens in partnership with health, with Children Disability Services, with our partners at St. Amant, the autism outreach workers. We continue to make those investments. We know about the rate of the diagnosis is increasing. We are adapting our system to meet those needs, and we will continue to walk this journey with all of Manitoba families.
Mr. Speaker, today's NDP has a strong record for delay, wait. Manitoba families with autism who have a child with autism have faced waiting lists so long that their child can start school without even beginning to receive ABA therapy.
That's terrible.
Let me be clear. There is a critical window for ABA treatment in the first few years of life if one is going to achieve maximum lifelong benefit. This NDP government has so mismanaged the program that some children may age out of eligibility without ever even starting treatment. How will the government address this urgent situation right now?
We will continue by supporting all Manitoba families. When children are diagnosed with autism spectrum disorder, it takes the whole breath out of a parent. I've had those conversations. We need to make sure that when we are developing a system, that it is equitable, that it is sustainable, and that it provides as for the continuum for the child and that family. That it is important that we offer them other services, multiple services that they can choose from. We have services that happen throughout the healthcare system, throughout education, through family services itself, as well as we have many not-for-profit organizations that provide valuable service. It is about an investment, a consistent investment. We have $23 million that we have invested. This province is continuing to make investments for children diagnosed with autism and their families right up to the age of 21, and we will continue to do that.
All Manitobans, except many with autism, many who've had their kids taken away by CFS, many who are protesting even today in front of the legislature at the poor performance of this government.
No kidding.
The minister tries to bluff out of her bad situation.
Was shameless.
While the Premier and the Minister huff and puff, Liberals will hire more psychologists and cover psychological services for children with autism under Medicare to ensure no child has the long waits now being experienced under the NDP. Children cannot and must not wait until the NDP glue their broken house back together. Why is the Premier not hiring more professionals and acting to include psychological services under Medicare, which is so obviously the right thing to do to make sure children get the services they need when they need them?
Thank you very much, Mr. Speaker. As I've said earlier, that we've continued to make investments, $22 million. That's an 800% increase since 1999. And that investment has provided a continuum of supports for families. It could be an example of ABA, but it also is the autism outreach worker. It's speech and language. It's the supports through the healthcare system. It's respite for the family. It's supports within the education. And what we've done is we've made those investments and we've continued to expand along the life cycle, going up to the age of 21, making sure that we have transition programs at Red River College, making sure that if a family needs some support within their family unit, that we're there to provide it. We're going to continue to make those supports, and we will continue talking to people about an 800% increase.